Hi, everyone. It looks like there are a few people on, and it is noon. I'm Dr. Kris Wallace, and we are getting started for our Get Your Sexy Back webinar today, talking a lot about sex, libido, and relationships. So hopefully you have your lunch right there and you're ready to listen. This was actually a PowerPoint that I did for a conference, women's conference called Flourish. A lot of women participated in that conference and got a lot of great feedback. So I'm kind of just presenting to you today those slides and kind of all the things that we talked about that at that conference. I also have this particular presentation on my podcast at Get Personal with Dr. Kris. And that's going to be on any platform that you listen to. So if you hear it today and you have more questions and you want to listen to it again, or somebody that you know couldn't listen today, you can also go and listen to it at the on the podcast. So I'm going to give everyone maybe another minute or two to get online. In the meantime, if you have any questions while we're working through our webinar, you can absolutely put your questions in the chat box, and I'll take a look at those, and I'll probably just answer them as we go. There's no real formality here. That's typically not how I operate anyway, if you know me. Pretty relaxed, especially when you're talking about sex and libido. So if you're not relaxed, it might not be very good for many reasons. So give you all just a minute. We're about halfway there for the amount of people that signed up, or 3/4 of the way. So I'm going to go 2 more minutes and then we will get started. I hate when I can't actually talk to you because you're out there behind your computer screen and I'm here. So if you're bored and you really want to just say something, totally tell me in the chat so we can talk to you about it. And specifically, if you have any questions before we get started, or are wondering about if I'm going to cover such and such. A little background, if you don't know me, I'm a naturopathic physician at Desert Wellness Center. There are 8 of us here at Desert Wellness Center right now, primarily treating women. However, we treat a lot of men here as well, and even adolescents in all forms of natural medicine. We do have a tendency to specialize in men and women's health as we age, 40 and above. Especially in my practice, I see a lot of men and women over the age of 40, especially as how in the area of anti-aging or aging gracefully, trying to get you to feel like you again, basically. Our hormones do a lot of up and down in our 40s, which we're going to talk about, and then just kind of hitting the road in our 50s, which really changes a lot of the way we live our life. So here at Desert Wellness Center, we will help you through that journey. So let's get started today. Part of that journey is our relationships, and in particular, libido and sexual function. This is always something that comes up in my practice. Always something that men and women come in and say, I don't feel like myself again. And oh, by the way, I have no libido. Maybe you had some when you were younger. Maybe it wasn't that great, but it's like gone now. So that's what we're going to talk about today. So let's get started. First of all, let's make some definitions. A lot of my patients know this, and if you don't know it already, a majority of my background is not only in exercise, but also in psychology. So my master's degree being in health psychology, I did a lot of study on different psychologists, and yes, I studied Freud a lot. So here is kind of some of our definitions. Libido was first described, believe it or not, by Sigmund Freud, meaning desire or lust, and it's that drive for sexual activity. Sex in another is more the actual physical activity of intercourse, sex, orgasm. We'll be talking about that. And the relationship part comes because It takes two. You can't fix the libido, fix the sexual function if the relationship is broken. So they're all connected. I don't think one really comes before another. I think it all works together. And I love this quote from a book that I use. I took a lot of information on my webinar and this whole presentation from a book called The Sex Drive Solution for Women by Dr. Landa. A woman's libido is tied to her hormones, but it's also woven into her thoughts, dreams, sensory experiences, creativity, and feelings towards her partner. So that kind of just wraps it all up. And we are going to talk about all of that. We get so many changes over the age of 40, or maybe after your last child was born. That might be in your 30s. I see that a lot as well. But there's just so much craziness that we don't have time to feed our relationships. And physiologically, we're losing all our hormones. So, and we're not really meant to procreate after the age of 40. So naturally, our hormones just start to deplete. And basically, I thought the other thing that was interesting is, in a relationship, when sex or the sexual relationship is going well, it's maybe 15 to 20% of our thought process, or even part of the relationship. It's like, okay, this is good, blah, blah, blah. When it's not going well, I don't know about you, but it's kind of like that elephant in the room. And it can be a powerful 50 to 70% of a problem or dysfunction or dysfunctionality in a relationship when it's not going well. So when it's going well, it's kind of like, no, this is good. When it's not going well, it's a big deal. So let's fix it best we can. So libido in general, we get testosterone gets a lot of attention, which it should. And we're going to talk about that, but it's all about a balance in our life. It's all about the stress that's going on, or a lack of exercise, or a poor diet, up and down in our diet, too much sugar, too much alcohol. That can totally change our outlook and our energy levels. Sometimes our medications that we're on, both prescribed and recreational, can affect our sex drive, our libido. And there's alcohol again. It certainly seems like when we drink alcohol that it increases our libido because it takes away our inhibitions, but then try to go perform after drinking alcohol, both men and women, it's not good. It's not a good scene because it's basically a depressive form of a drug. So it doesn't help with blood flow at all. In fact, it makes it a little bit worse. Also, what about men? I mean, I described a lot of us, women, and sometimes in men, but men also midlife, erectile dysfunction is a crisis, both emotionally and physiologically. They don't want to talk about it. It's embarrassing. They might have let themselves go. Maybe your partner is having these issues. And so therefore, that's definitely affecting your libido and your attraction maybe to your partner. It definitely goes both ways. And libido is not all about hormones. It's all about a lot of things, all of these things. So we will address those. So when we talk about the psychology of libido, remember I would go back to that first slide and how libido is about desire and drive. It's really kind of a lot of it's in our head as well as in our body. So there's a lot of our self-esteem and our emotions tied up into our libido. So many times we will fix the hormones, whether it be in a man or a woman. And then they'll come back the next time and they'll say, well, my testosterone, and I'll see on their labs that their hormones look fine and balanced. But they'll be like, I still don't got it. It's just not there. I don't know. I don't know what it is. It's the emotions. It's the self-esteem. Maybe your weight's not where you want to be. Maybe you have trust issues. Maybe something happened in your past. If you don't feel loved or you don't feel safe, all of those things affect libido. Dopamine and serotonin are giant, very important neurotransmitters when it comes to our libido. Dopamine is that feel-good hormone or feel-good neurotransmitter that causes us to seek out things like sex to make us feel good, or eating or shopping or drinking or smoking, all those things that can make us feel good. If the dopamine is not being released properly, we won't be searching for our libido, will be suffering. The other thing is if we have too much anxiety in our life because the serotonin is too low, how in the world could you have libido if you're always anxious? So one of the important things that I've discovered in reading and research in the psychology of libido is it's kind of about mindfulness. That's kind of the secret sauce emotionally. And what I mean by that is there is a mindfulness that needs to happen in our sexual life. Basically, we have to be present. We can't be gone. We can't be thinking about what needs to happen next and what needs to happen or what happened yesterday. It can't be a list. It has to be practicing this mindfulness. We can't be being sensual and sexual is all about being in the moment. So part of increasing our libido and our sex life is being able to be present, practicing that. I feel like it's a little bit of a cliche, mindfulness, because especially being in the psychology world for over 30 years, it's been used, believe it or not, for over 30 years, even though it's kind of like a big deal now. It's been a big deal for a long time. But being able to just be present and in the moment is going to be one of the big things that you can do to get better libido, a better sexual outcome or sexual results, and increase your relationship. Feeling sexy is probably one of the biggest blocks I see in women's health, if it's not the hormones. That means, only in the past 100 years or so has our current body shape been a thing. Social media telling us how we're supposed to look. If you're having a problem with libido and even with orgasm and what happens during intercourse, check in with yourself. Are you afraid to, or are you uncomfortable being naked? Are you uncomfortable being naked in front of your partner? But mostly, are you uncomfortable being naked in front of yourself and in front of a mirror? Because I promise, if you can get more comfortable with that, being comfortable with yourself in front of a mirror and in your own skin and in your own body, you will be much more willing to share that. It is just how it works. So many times when we have a block, and again, hormones are fine, everything else is fine, and then we lose weight or we get involved in a really good exercise program, all of a sudden it's like, whoop, oh, I'm happy, I'm feeling good, and all of a sudden, whoop, libido just went up because we are now feeling more sexy. Sometimes the best way to do that is if it's not a weight thing, because weight's kind of like, well, okay, I'm okay with that. Maybe it's just your own physical body. First, get in touch with your body. Get in touch with everything that happens to be part of that sexual experience. Breasts, buttocks, vagina, for all those things. Getting in touch with those areas and being comfortable with them because they change. I'm not telling you something you don't know, but they change. After having babies, they change. After 40, they change. After 50, they change. Being comfortable with those parts of your body and getting to know them will help, and know what makes them feel good. Your senses are a big part of your physiological sexual response, and also your libido, having desire. Touching creates oxytocin. Oxytocin is released in the brain. It's another neurotransmitter that makes everything better. It makes you feel attached, and it makes you feel like you want to be with somebody. That's why hugging feels good. It's that sense of touch, love, and bonding. Oxytocin also increases testosterone and estrogen. So once you have that sense of touch, once you're feeling touched, then all of a sudden estrogen and testosterone gets released, and that's amazing and feels good. The sight and sound or touch between you and your partner can be all you need to ignite that libido again. It doesn't take much more than that. And you know what else? Pheromones are real. And I mean more in terms of like scent, in like perfumes can bring about this. Perfumes are made chemically to bring about pheromones and also to bring about that desire. But I have to say, side note on perfumes, it's not really a good idea to wear them all the time because of the toxins. I just had to say that. But occasionally they're okay, like on date night. But that's why we wear perfumes. They bring about those pheromones. Finally, something important to note here, and what I deal with a lot in my practice is hysterectomy. So let's say you had an issue, a uterine lining issue, you were bleeding a lot. You decided that between you and your other physician we need to take the uterus out. Well, we'll leave the ovaries for hormone's sake, but we'll pull out that uterus. The problem with that is it does help, and you do have your ovaries, but a lot of times those ovaries are going to fade away in the next couple of years after hysterectomy, whether you're 40 or 50, or even 35 or 38. The reason is because the ovaries, your body's not silly. And it's not stupid. It knows. It's like, why in the world am I producing hormones and releasing eggs when they just go into this empty cavern? There's nothing there. Nothing's happening. So eventually, what I see patients in my office, 45, 48, that have had a hysterectomy or a uterus, just the uterus removed. So they still have their ovaries removed about, I don't know, maybe when they were 42, so 4 or 5 years ago. And they're like, I should still have all my hormones. That's what they said. I'm going to have my hormones. But they're not there anymore because nobody measured them because they're supposed to still be there. And now we measure them and they're gone. And that's why you're feeling terrible. That's why your orgasm's gone. That's why your libido is gone. So just because you had a hysterectomy and spared those ovaries doesn't mean that you're not experiencing symptoms of menopause early. So that brings us to hormones. Of course, it's a big deal, right? It's the interplay. It's not just testosterone, although that's a really big deal when it comes to libido and sexual function, but it's the interplay between those hormones. It's the interplay not only between estrogen, progesterone, testosterone, but also your adrenals, your thyroid, cortisol, all that matters. Let's talk about estrogen for a minute. It stimulates puberty. It helps build up the uterine lining. It stimulates growth. It's very important for us as women in terms of longevity, in terms of our bone strength, our brain being healthy, and all of the above. Low estrogen contributes to vaginal dryness, vaginal atrophy. I don't know about you. If you know what atrophy means, it means something is going away. So nobody really wants their vagina to atrophy. Not good in the same sentence. It benefits all those things, the memory, all of those things. It also is responsible for weight gain in perimenopause and in menopause. When our body senses that we are losing estrogen and our estrogen is not where it should be, it automatically begins to store more fat because your body knows it can get estrogen from fatty tissue because that's where we will store it if we're going to store it. So estrogen is stored in fatty tissue. As we have less estrogen as we age, or even in perimenopause when our hormones are doing this, more estrogen, less estrogen, more estrogen, less estrogen, our body will store more. That's where we get the weight gain. So estrogen is very important for weight management in women in that way. Progesterone is the hormone that makes you feel just good. It helps you sleep. It calms down anxiety. It protects us from excess growth of the uterine lining of the cells of the uterine lining. So it helps us so we don't bleed out during our periods. It also helps our thyroid work better. It can help reduce, balance our blood sugar as well. So, and decrease water retention as long as it's utilized properly. Those two have to be balanced, estrogen and progesterone at all times. Otherwise, we end up with trouble. So then as we move forward, what about testosterone? Yes, absolutely, 100%. It's important. Men make 10 times as much as women. No surprise. But I will tell you, it's important to know that because when we do replace testosterone in men, which we do, they are supposed to get more than us. That's important. But other thing to keep in mind is it is produced in both our ovaries and our adrenal glands for women. Men, it's mostly in their testes, also some in their adrenal glands. But that means that even when our ovaries aren't working anymore, we rely on our adrenal glands to kind of keep our testosterone intact. If our adrenal glands are out of control, even if I replace your testosterone, it's not going to work. It's not going to feel good. You're going to be one of my patients that comes in and says, you told me if I replace my testosterone, I was going to feel great. Well, I don't. And that's because your cortisol is still a little crazy, not intact, not doing great. So again, it's that interplay. Your thyroid and deficiency is very common and can affect the estrogen levels, giving us a lot of brain fog, low energy. I'm sorry, if you don't have energy, how are you going to have libido? You just don't have, you're tired. That's an easy answer, right? So we need our thyroid to give us some energy so we can have some libido. And then there's your cortisol, what I just mentioned earlier. So here's my labels where our frazzled women, and I came up to be like frazzled 40s, and I changed it to 30s and 40s. But it's the frazzled woman, the frazzled 40s. Premenopause can start as early as 38, but typically 40s, right? We have these hormonal shifts. Some months we feel good because our hormones are kind of imbalanced like they normally are. And some months we feel terrible because we've got too much estrogen for our progesterone. Remember how everything is supposed to be in balance? Well, as we are late 30s and early 40s, testosterone stops being produced. And then in our early 40s and mid 40s, we have less progesterone. And then estrogen's just way high. And that's not good. That's going to affect our libido as well. It adds to our weight gain when we're dominant in estrogen as well. Irritability. It ends up with low energy. And all of that, we are just too busy to pay attention to our hormones, and they're all over the place when we're trying to deal with all the things in our lives. Lots of shifting happening in the 40s. When we get to perimenopause, it's more about kind of the last couple of years before we actually enter into menopause. And that's basically, for the most of us, it's the end of the 40s and the beginning of the 50s. Now our periods are erratic or they're starting to go away for the psychological part. Classically, we have low estrogen, which is all those low estrogen symptoms. And physically and psychological changes, a lot of us are now experiencing this change. Like if we had little kids, they're not little, they're taking care of themselves. Or maybe they're in college and maybe now you're just sitting at home, like empty nesting going, what now? What do I do now? Like, where's my career now? Where's my life now? What's my relationship like now? So there's a lot of changes. And when you have a lot of that going on, you don't really want to think about sex or libido is kind of shot because you're just like, what do I do? Like, where is my life right now? This is really important to revisit testosterone, really in both of these times. Let's look back at testosterone again, because this is the hormone of physical arousal. This is the hormone of motivation, drive, ability to build muscle, blood flow. All of these things become even more important as we age. It's important when we're going crazy in our premenopause, and that affects our libido. But as we age, we need this mental and emotional support that testosterone really can give us. It gives us that support. Now we can have the desire. Now we can move forward with thinking about giving ourselves the bandwidth to think about libido and sexual function. So testosterone is always important, but sometimes I find that it's even more important as we age. So what about the other stuff? It's obvious. You come into my office, we're going to support your hormones. That's an obvious yes. And again, do I want you to have testosterone? Yeah, I probably will. What else can you do? You can support your libido, believe it or not, and your sexual function and your relationships with your nutrition. Natural state foods. These are all things that, seem obvious, but deserve to be reiterated, I guess. If you eat fats and proteins in combination with carbohydrates, all of them, you are going to have balanced blood sugar. Your insulin will be better. It'll be better for your body, and it will be metabolized in a better way so that now you are not going to have ups and downs. A lot of times our libido suffers because we're tired. I said that earlier. The fatigue is because now our nutrition is terrible. We don't eat enough. We eat too much. If you're in a position where you're doing binge eating, not eating on a regular basis, your stomach is full, you don't feel well, you're not going to have your libido is going to be, you're not going to feel good. You don't feel good about yourself, going back to the other slide, and you don't feel like sharing yourself with anybody else. The other thing is that if you're not eating enough, Many of us are struggling with our weight, especially in our 40s and 50s. And we're just like, oh, I'm just going to not eat, or I'm not going to eat carbohydrate. If we don't eat carbohydrates, we don't have B12. Our brain and our mood is going to be shot without good whole grain carbohydrates in our life. So identify if you're sensitive to foods. Gluten and dairy are pretty common ones. Decreased inflammation, eating foods that are decreasing your inflammation, less sugar, less alcohol. Believe it or not, nutrition affects your sex drive, and it is important. And these are the things that matter. Also, what about nutrients? Classic, in general, we're going to use nutrients to fill up those nutritional voids. Omega-3s are omega-3 fish oil are very anti-inflammatory. They also help with lubrication. So instead of adding lubricants, vaginal lubricants, which aren't bad, they're good. But if you want to lubricate all your mucous membranes, including the vaginal tissue, omega-3s are where they are. They help with brain function. They help with mood. Vitamin D is a mood driver. It's so important for mood. It's so important for all the endocrine system, which of course your sex hormones fall under. So without vitamin D, and even though we're in Arizona and we're like, we got a lot of sunshine, no big deal. That's not it. It has to be converted. Almost everybody needs a vitamin D supplement. Magnesium is going to calm the muscles down. If you're uptight and tense, there's no way you're probably going to feel like having sex or have a good libido. But it's going to be very difficult for sexual function, orgasm, if you can't relax to have blood flow. Magnesium is key. And then the probiotics are always a good thing for absorption. Now, I have down here sexy herbs, because there are herbs that are well known to help increase libido and sexual function. Most of the time, it's all about blood flow. So these are herbs that are going to increase blood flow, like, this one's not an herb. This is actually an amino acid, but L-arginine is an amino acid, increases nitric oxide and blood flow. Herbs, ginseng, ginkgo. If you look, B vitamins, there are actual libido herbal formulas that are made by many of the companies we use. And most all of those will include ginseng and ginkgo. They might include horny goatweed. I know I know you're laughing. I can hear you in my head. But it's pretty funny that that's actually an herb, and it is, and it helps with libido. So there you go. And it's usually in a lot of those different formulas that are made. And they work. A lot of the formulas, they'll work as long as you're using them in conjunction with other things, the hormone balancing, the nutritional things. There is the secret ingredient to Scream Cream. That Viagra in its form for men also can be used for women. It's a blood flow. So the Scream Cream is something that we have to prescribe through the compounding pharmacies, and it is applied topically before intercourse, and it helps with, you got it, blood flow. And then finally, maca is the fertility herb out there that's been used for years and years that increases hormones. So there are natural things that you can do in addition to hormone balancing that will help with libido and sexual function. And of course, I'm going to mention exercise to you because it's my thing. I love it. It is very important. It increases your feel-good hormones. It manages your body fat and your weight. It helps with circulation. It depletes cortisol, so now you can relax. It encourages that relaxation response. If you're having a difficult time with orgasm, let's say libido is fine, orgasm, blood flow is not your thing, you're having a difficult time with that, I promise if you start a regular exercise program that increases your blood flow, you will see help in that area, especially if you engage in exercise first, and then let's say you're exercising in the afternoon and then intercourse later in the night, or anything that's going to require sexual function later, you will find that it helps. So scheduling sometimes exercise around what times you might have intimacy, try it. It'll help. It works because your blood flow is now increased Your cortisol is now decreased because it went up and now it's down. Relaxation's increased, and your endorphins are right out there for you. You just release them during exercise. So is exercise an aphrodisiac? Kind of, I think it's, I don't know. Test it out for yourself and let me know. Prescription medication can get in the way. This is not the time when I'm telling you to stop taking these medications that you've been prescribed. It is the time for you to understand that if you are taking some of these prescription medications, they can affect both libido and sexual function. Now, stopping them abruptly can affect your relationship negatively and your body negatively. So, but I want you to understand and be aware that there are medications that affect this. A lot of them, some common ones, SSRIs. So that's all your mental health anti-anxiety medications. Your birth control pills decrease your libido because they bind up your hormones and they decrease your hormones in general. Anti-seizure, blood pressure medications are really difficult for sexual function, especially in men. It requires an increased pressure and then a decreased pressure for an erection. So those blood pressure medications definitely get in the way. Any sleeping pills, pain meds, anything that suppresses the system or blocks hormones. Antihistamines is something I like to reiterate to people that most people don't know. An antihistamine can affect both libido and sexual function, especially in men. So if you're on an all the time like, oh yeah, I take Zyrtec every day, just every day, cause okay, how about you just take it in the times when you need it? Or we can talk about some alternatives, because all the time, every day antihistamines affects definitely affects erectile function. So often replacing hormones can help take you off some of these medications, because a lot of times these medications are because of hormonal imbalance, but don't do that without talking to your doctor. Here's, I just mentioned all these things. These are all basically prescription medications that sabotage. Well, no, just kidding. These are some of the things that sabotage your sex life in general. So I just kind of as a summary, if you increase your energy, you're going to increase your libido. So what's in the way of your energy? We already talked about supporting your adrenals. Get some sleep. If you're tired, okay, here's one thing. I've had patients so often say, I'm too tired. I'm too tired. Like, I'm not a night person. My husband or partner is a night person. And so, 9 o'clock comes around and I'm just exhausted. I can't do it anymore. So I'm not interested. Okay. But something's wrong with me. I'm like, what do you get up in the morning? Well, I get up at like 4:30 every morning because I want to do my workout. Oh, okay. Well, there you go. How about you sleep in 2 days a week, swap out that morning exercise with something later, and then you will have more energy, and now you might not be so tired at night. Just a thought. These are all those things that can help. I have a question about birth control, and I'm going to answer it because I think it's something that many people wonder about. If your hormones are erratic, not erotic, that's a Freudian slip. I love it. If they're erratic in your mid-40s and they affect mood, what else can be done to help with the erratic fluctuations? So if you're talking about what other forms of birth control can you take, a lot of times using a non-hormonal IUD in your 40s will help. You can do that, and that way we can address your hormones separately. That helps. The other thing is, what else can be done to help erratic fluctuations in general between 40 and 50 with those erratic hormones? That's easy for any of us here at Desert Wellness Center because we do it all day long. We will replace your hormones with bioidenticals. So a lot of times just bringing in progesterone will help. Bringing in progesterone and maca will help. Progesterone, a little baby bit of estrogen will help. Testosterone in general will help. So replacing the hormones, that's an easy thing. But dealing with birth control in that age, a lot of times it's better to either pull out and the hormonal birth control and go with an IUD that's non-hormonal, or using a progestin-only IUD. A lot of times those help, and then we give you progesterone anyway. So that's a good thing to discuss with your doctor, but that's what we do. I absolutely do not like birth control pills over 40. I think it's not necessary. There are other ways we can do birth control and other ways we can manage your hormones other than that. So let's move on to how to revive or the bored libido. I think this is important. Let's say we did it all. Let's say your hormones and your relationship are intact. We did it all. But we got the same guy, the same bed, the same routine. So how are we gonna do this? So a couple of options. And these were things when I read about, I'm like, oh my gosh, that's interesting. Schedule sex. Here's the thing. Movies are not real life. I know I'm not telling you anything you don't know, but take the pressure off here. We don't have to be spontaneous. It isn't like we're going to go home and, take all our clothes off and jump on that kitchen table. That might be kind of fun. That's probably not going to happen. It only happens in the movies. What we might need to do is take the pressure off of, when is it all, when is this, how do I need to be ready? Blah, blah. Scheduling really does happen. It really does make a difference. It removes pressure. We know it's coming up. It uses anticipation as foreplay. And sometimes with just still kids at home, when you're in that age, you can schedule kids to be away, schedule kids to be somewhere else, or whatever it might be. Try scheduling it, agree on just 2 different days or 1 day or something, just to see if it works out for you. This is something that I read in numerous studies that can be helpful. And when you're ready to explore how can we make things more spicy, get to know yourself. A lot of times, women, as we age, we forget about how it feels to even feel that sexual arousal because we've let it go because we were too busy. Exploring your own sense of sexual arousal or having your partner explore with you using other things is sometimes the best way to change your journey and change your intimacy together. So being open to trying some of those things together and or by yourself, because if you don't know what's making things feel good, how in the world is your partner going to know what makes you feel good? So being open and honest with yourself on that has been one of the better ways that a lot of my patients have found that it really helps to revive that old libido. So basically, this screen tells you what's your thing. So we talked about a lot of things. What's maybe your thing getting in the way of your sex drive? Is it your relationship? Is it something that, okay, maybe we need to schedule some more dates, not necessarily anything that has to do with sex. How about we need to just schedule some more time together? How about we need to have that 30 minutes of going through our date conversation? That helps. Or is it me? Do I need more support? Do I need more support from me? Do I need to plan? I had a patient recently just come in and say, look, I'm done. I need time for me. This is just what needs to happen. I'm like, good. That's what I want to hear. So you need to take a break. Maybe you need to schedule a massage or you need to go out and do something on your own. Do you have hormonal imbalance? Is your estrogen too low? Are you, is everything dry? Do you have night sweats? Do you have hot flashes? Is it just that everything's low estrogen, low testosterone, low progesterone, just everything's low? Or do you have some estrogen dominance? That happens in the late 30s and early 40s because you feel puffy, you feel emotional, everything is off, you've gained weight. Bleh. That might be dominance. So those are hormonal imbalances that we have to look at. What about your sexual confidence? Remember, we talked about getting to know yourself, feeling good about your lifestyle, feeling good about your hormonal balance. Just where's your confidence level? And or is it just nutrition and diet? Do you just feel off because you're not eating great? Or you feel like you've gained weight? Or is it maybe just your exercise too much, too little, not at the right times? There's so much more that goes into libido, sexual function, and your relationships than any of us know. And it's complicated, but then again, does it have to be complicated? Look at this screen, take a screenshot of it, take a picture of it. it's a good way to just kind of go through that checklist. It's not always hormones. I like it to be hormones because I know I can fix those really easily, but it's sometimes other things, what you're eating, it's your relationship, it's how you're exercising, or just how you feel about yourself, your self-confidence level. Here's some resources I want you to see. The Sex Drive Solution for Women is a book that is amazing. It's good. It's easy to read. There's a lot of what I talked about in that book. I like Goop Sexual Wellness on goop.com or on Instagram. They have some good options for getting to know yourself or sharing with your partner, or it's just some really open, professional, and clean ways to do that. Getting the Love You Want is a good one for couples. Why Marriages Succeed or Fail. So I think these are good resources. Somebody is asking me or reminding me, wondering about different ways to do testosterone. Already doing estrogen and progesterone, but feeling like she can't handle testosterone. Testosterone also, on that note, can have side effects. As a female, some females will break out acne, some will have hair growth they don't want, they'll get bloated. The form does matter. I love pellet therapy. Some patients don't do as well on pellet therapy. Some people will do creams. Some will do a lozenge. There is going to be a kind for you, the person that's asking me this question. Trying all those matters, using maybe even maca or some of the libido drivers that are in supplemental form can help. There's also topicals that you could try, topicals being applied to the labia. Sometimes that's been a better form of testosterone for women. Don't give up, because there's going to be something there for you. Okay. So if you have more questions, you're not one of our patients, or maybe you are a patient and you see a doc here already, you can call and talk to your doc, and see if you have some extra questions. If you're not, you can go online, get in touch with our office, see one of our very capable docs in terms of balancing your hormones or any of those life things that we talked about today. If you want to hear this again or a different form of it, you can listen to Get Personal with Dr. Kris. It's on all the platforms, Spotify, Google, Apple. I have a lot of other podcasts that address all these other things as well. Weight loss, supplements, all of those things. So if you have more questions about any of the things we talked about, then you can check in with that. Also, if you have any particular questions, you can put in the chat real quick. And I know my poor person that asked about testosterone's tried all of those things, Oh, I'm sorry. Testosterone can be tricky. But even if you haven't, sometimes it's alternating the kinds. If you've haven't tried the hormone, haven't tried the botanicals, maybe the herbs might be the better option for you. But I encourage you to talk with your doc or call one of us to take it in a more specific direction. Any other questions before I let you all go for your lunch? Well, thank you so much for listening. I appreciate you. And if you have any other questions, here's where to contact me or anybody here at Desert Wellness Center. And I hope you have a great rest of your day and a sizzling night, maybe, or morning. Thanks so much.